Dear colleagues and friends, it's time to start our annual endovascular course. In fact, we have the highest possible distinguished guest in the field of vascular and endovascular medicine in the world. It's a huge privilege, and I will ask probably one by one to say several words before the real opening of the course. This year's endovascular course, like usual, will have several accents, let's say. You know very well that worldwide, during the last several years, one of the biggest accents in treatment at all, in all kind of treatment, is the treatment of stroke. So this is a huge challenge. In fact, it's one of the biggest killer, and for sure the biggest disability reason in the world. So the mission, it's a real mission to treat the stroke on the proper way, and most important, on time. Not only on the proper way, is definitely to treat the stroke on such a way. And because of that, I will give the floor to Professor Grunwald. She is the real pioneer of this kind of modern treatment that is, during the last years, is definitely the established golden standard. And all of us, we will have the privilege of her expertise to be here among us. Professor Grunwald, Iris, please. Thank you for coming.
Dear Ivo, thank you so much. Thank you for those kind words. It is an absolute pleasure to be here again, be amongst the team. What you have organized here is a conference and a meeting of excellence, which is so established by now. You have managed to bring together the different specialities, and that is what really counts. It is not working in silos, working in neuroradiology, working in cardiology, in radiology. It is really working together, and this is one of the few conferences where we can all learn from each other, where we can share our experiences, and it is a true example of multidisciplinary joint working. And I congratulate you on managing to organize this event again. We are fully behind you, same as the World Federation for Interventional Stroke Treatment, WIST. This is the way forward to treat stroke, to treat this important disease. We cannot tackle it on our own. We need to work together. Thank you so much.
Thank you. Thank you so much. We have our pioneers in among us, and definitely everybody of us, everybody of you knows very well Professor Matthias. I will ask Professor Matthias also to say hello. He's in fact not the pioneer, he's the father of carotid stenting. That is definitely one of the most important interventions.
Yes, Ivo, thank you very much for the invitation again to come to Sofia. We have some anniversaries. It's not the 100th meeting, we know that. But when you look back in history, yes, next year we have 60 years of percutaneous angioplasty. It was the first time that with the 9 French catheters they opened up an occluded femoral artery, and now it's going from head to foot, that we open up occluded arteries, we heal aneurysms, but also we deal with tumor patients and many other things, and also many of the heart diseases are addressed today by endovascular techniques. So when you read here endovascular course, then you know that's nearly everything from head to foot. And yes, the carotid, we also have an anniversary. I did that the first time in '76. I was nearly beaten by the vascular surgeons. Crazy guy, will produce only strokes. Yes, they did not address. When I show our first pictures and results of carotid angioplasty without stenting at that time, there were no stents available. It was simple ballooning. Yes, then an elderly gentleman went up and said, "Oh, that's a nonsense, should be immediately forbidden," and so on. The young guy doesn't know what he's doing. And I went back to the microphone. I will not talk now for 2 hours. And I went back to the microphone and said, yes, but when we never try something new, then we would be still in the Middle Ages. That was not very consoling for the... So I got an official, not me, my chief at that time, got an official letter of the German Society of Vascular Surgery, yes, that they have discussed it and it should be stopped and so on. But I had a very good chief. He called me, he showed me the letter. I was there like a question mark. And he said, "Go on, but be careful." And so go on and enjoy the day.
Thank you, Professor Matthias. In this task, you will hopefully agree, in this task, treating vascular and cardiovascular diseases, we have to be, let's say, together, and we have to be well organized. Like Iris mentioned, WIST, the World Society of Intervention for Stroke, and definitely one of the most important societies during the last more than 20 years is the International Society of Endovascular Specialists. And this society was built by giants and pioneers like Ted Dietrich, our teacher, that he taught us how to do the things properly on all the level of cardiovascular continuum, from the heart to the aorta, to the peripheral, to take a look at the endovascular and intravascular imaging. In fact, we have the privilege to have here among us our friend. I would say it's a privilege he to be our friend. This is Dr. Reed, who is in fact one of the previous presidents of International Society of Endovascular Specialists. Please, Dr. Reed.
Wonderful to be here, Ivo. And the International Society of Endovascular Specialists was started by Dr. Dietrich, by Dr. Fogarty, and Frank Criado, and Rod White, and Jacques Bousquet, and a few other people at a meeting in Bordeaux in 1992. And it was really done in order to have people get together to do something new, which is not ever an easy experience, because as Dr. Matthias has just said, people don't like something when it's new. And I think, Ivo, what you have done with the Balkan endovascular course is hugely supported by the International Society. Dr. Dietrich came here to see you personally, to support you, to become your friend. And the Balkan endovascular course allows people to get together and do new things, and I think you're doing a wonderful job. I've really enjoyed watching it evolve since I first met you 15 years ago at the Takuta Clinic, and I've seen also not just how your own family has grown, but how then the city clinic was grown. And I've got a lovely photograph of Ivo and myself on the roof as it's being built. Dr. Kirillov, I'm so pleased that you are here to represent the government. In a very small way, no one's told me to say this, please support the City Clinic. They are doing a superb job of new treatments for Bulgaria. And I know a little of how difficult it is in running a hospital and getting reimbursement for all of the treatments that they are doing. And I do ask you if you would please help support them do this. He's not asked me to say this, but it is important for your country that he's allowed to do this good new work. Ivo, I wish you well with the meeting. It's a great pleasure to be here. Many thanks.
I'll ask our local real pioneer in treating vascular disease, and this is Professor Gruzdinsky. Professor Gruzdinsky is my teacher during many years. In fact, he was the guy who stimulated the development of the modern intervention in vascular disease. Professor Gruzinski, please join us. Please join us.
I'm sorry, but my English is very bad. And I say in Bulgarian, искам да поздравя и Иво Петров, и всички присъстващи, тук лидери в ендоваскуларното лечение, за това, което се опитваме да правиме. Преди 20 години в България ендоваскуларното лечение беше екзотика, хирургията беше лидер и когато преди 10 години аз казах на Доналд, че ако съдовите хирурзи не почнат да работят ендоваскуларно лечение, ще трябва да си бъркат за храната в кофите за боклук, той се засмя. Но това е факт. В момента съдовите хирурзи станаха ендоваскуларни специалисти. И аз съм много щастлив, тъй като ние с професор Петров сме тандем, нали, и той от кардиолог, покрай контакта с мене стана и ангиолог и това е изключително полезно, тъй като лечението на сърдечно-съдовите заболявания трябва да бъде комплексно. Модерното лечение в момента на сърдечно-съдовите заболявания е ендоваскуларно. За съжаление, профилактиката е много слаба, медикаментозното лечение е също много слабо и всъщност сегашният акцент е върху ендоваскуларното лечение. В бъдещето, може би, ще се измислят нови методи, нови медикаменти, но сега ние сме лидерите в лечението на сърдечно-съдовите заболявания и аз поздравявам професор Петров и всички, които се занимават активно с тая дейност, защото благодарение на това може да лекуваме страшно много хора, да спасяваме човешки живот, а това е смисъла на медицината и на това, което правим. Благодаря.
Professor Gruzinski has spoken regarding the growth of the treatment from surgical to endovascular, about the real collaboration between specialties that is definitely crucial for the final success. And he mentioned it's an absolute fact that because of his stimulation and encouragement, I myself, I became from cardiologist, I became cardioangiologist. So somebody who deals with the cardiac and vascular care. And definitely in this collaborative environment, we need the support of the institutions. Without the support of the state and the institutions, it's not possible to go ahead. And because of that, I will share with you that we have the huge privilege to have not anybody else but the same Minister of Health of Republic of Bulgaria. And I would like to ask Professor Kirillov to come to the podium and to say several words about the institutions and how they intend to support our efforts.
Уважаеми професор Петров, уважаеми гости и ръководители на сериозни международни институции в ендоваскуларната хирургия, уважаеми колеги, за мен е чест, гордост и удоволствие да бъда между вас в увертюрата и откриването на този сериозен научен форум. И виждам много млади колеги тук. Искам да споделя с тях, че мечтите са безплатни, но те са изключително важни, защото дългия път в професията минава през мечтите и аз съм сигурен, че вие ще достигнете и по-големи висоти от вашите учители. В този ред на мисли искам да припомня и думите в Хипократовата клетва, която всички ние сме произнесли за ролята, мястото и уважението на нашите учители. За сега те са на подиума и в залата, но цял живот те си остават наши учители. И не на последно място, понеже тук прочетох, че става въпрос за ендоваскуларна академия, искам две реда от една клетва, която от един химн, който ние всички сме изпълнявали. Това е Виват Академия, Виват Професорес. И с тези думи към вас искам да ви пожелая едно блестящо бъдеще в тази уникална професия и ви пожелавам успех, удоволствие от работата, която ще извършите. На колегите, които днес ще споделят своя опит, пожелавам една успешна работа, едни дискусии, които да предизвикат удовлетворение във вас и да бъдат не само урок за младите, но да имат и възпитателен ефект, защото аз винаги съм казвал, че диференциално-диагностичното мислене на лекаря е висша форма на абстрактно мислене. В този ред искам да пожелая една успешна работа на днешния форум, на всички вас здраве, късмет на семействата и за да се придвижиме към нашия идол, бъдете благословени. Благодаря.
Thank you, Professor Kirillov. He mentioned several very important messages. Probably one of the most important is that we have to respect the teachers. It's definitely one of the main reasons our society, the medical society, to be so important and so firm, because we are respecting our teachers and we give all the respect and love that we can. But in fact, not only our conference, the majority of the conferences have to be patient-centric. So our main target, our main mission and main goal is the patient to be on the pedestal and the patient final good result to be the most important. Speaking that, I will share with you that as traditionally we are going to have several live cases every day for head-to-toe endovascular intervention. So hopefully you will enjoy the course, the live cases, the simulator in the rooms aside. There are several simulators. And tomorrow we are going to have also the nurse and X-ray technician session, who are definitely invited to join also the main program without any obstacles. And we have to thank for the support, in fact, the companies, the pharmacy, the pharmaceutical and material and implants companies that are definitely, we are together in this carriage. So it's a mutual respect, mutual support, and this is very important to have the science and the practice to go ahead. So this is one of the conference goals is really to go ahead to spread the knowledge and the practice of endovascular. Thinking endovascular is important. So all the specialties I mentioned several times, it's a multidisciplinary conference, like is the International Society of Endovascular Specialists and also WIST. Iris, thank you, Iris, for paying attention to cardiologists. So we cardiologists, we are open-minded. And in fact, with the skills of cardiologists, I say many times to our colleagues neurologists, you have to lead the treatment, and we are workers. So you understand the things, we can do them. So it's important to have the leadership of the proper person, but also to have the proper person to do the things. And the proper person has to be taught, instructed, and certified. It's very important. So what Professor Grunwald is doing, it's a real certification on a fantastic environment. And thank you for supporting our national efforts in this regard about treatment of stroke. Of course, not only stroke, you are going to see several cases of thoracic, aortic arch, abdominal arch, iliac, femoral, below the knee, visceral, pulmonary artery. And you understand already, this is the reason among us, you are going to see many colleagues that are pulmonologists, gastroenterologists, radiologists, anesthesiologists, vascular surgeons, cardiologists, all kinds of specialty that can some touch about vascular pathology causing different diseases. In fact, the vascular underlying cause can cause many diseases in all the field of the medicine. But the beauty is that we have the chance in most of the cases to treat all this situation by endovascular means. And saying that, with not more conversation, I would like to thank you, all of you, for the support of being here. And I'm absolutely sure that, like myself, we are going to, in fact, to learn a lot during this conference. And with that, I'm announcing for opened the Balkan Endovascular course, Endovascular Academy. Thank you very much, and good luck, good success. Jumping on the task. So we are opening, in two parallel rooms. Here is the room 1, and in the room 1 we are starting with the liver and visceral endovascular procedures topic. And just aside, the other room is the endovascular head to toe part 1. Starting with Dr. Martinov with acute thrombosis and bleeding. And here we have the POCUS assessment of acute gut ischemia. Thank you. Thank you so much.